order must come from the legislature. Half a day. Before I begin, I'd like to start with a few clarifications. First, I know that some members of our community have asked for a complete lockdown of Guam. Let me be absolutely clear. That is not possible in a free society protected by a constitution which guarantees certain fundamental rights. As I have said recently, and according to my conversations with the Attorney General, I have called for checkpoints with penalties and fines and an adult curfew. But the legal authority I need to restrict movement during a public health emergency or enforce the mandate of an executive order must come from the legislature. Without this specific authority, these measures are not in effect. I believe that these are serious measures necessary to save human life, yet I cannot ignore the fundamental rights of individuals or the legitimate role the legislature must play in this process. Secondly, no one needs new laws to do the right thing. Exercising social distance is a choice you can make on your own. Staying home saves lives and will end this crisis sooner. No one needs legal permission to take that simple step. I have received many questions about what is allowed and what isn't under the executive orders. I appreciate the community wanting further guidance to ensure they are following the guidelines. But beyond what is allowed under the Social Isolation Directive, there are three things we should follow. First, stay at home as much as possible, full stop. Second, avoid any social interactions with those outside of your household. While I know this may be difficult, please do not visit your extended families who do not live with you, especially if they are elderly or vulnerable. Third, go out only to do essential tasks like crucial work, buying food, or getting medicine. Many people want to remain healthy right now and have asked about running and walking. I'm glad people are exercising, and we have allowed individual use of parks and beaches for this reason. But after you exercise, go home. These measures have been implemented to minimize physical contact as much as possible. The virus cannot spread if we minimize our contacts and if we limit our time outside. In theory, this is very simple. But in practice, I know how difficult it can be. This requires us to change our habits and our mentality. It forces us to avoid practices we have been taught to show respect, like embracing each other and manini. The very core of our culture involves socializing and being around our family and friends. But for social distancing to work, you must limit yourself to people within your household. I know this is a sacrifice many of you are making right now to keep your family safe. I am further asking you keep our community safe as well by staying home. We must each do our part, protect our island, and remember, Munga manbatiku I fasen iman amku, sa sinyaho man tinatni. Today's COVID hero is Cutie Petunias, Andrea Braille, and her parents. Together, they donated water and other supplies to the hardworking staff at the COVID isolation facility. Kind gestures like this go a long way. Thank you for being a COVID hero. Now I'd like to bring Admiral Manoni to say a few words, and maybe you can introduce your PA. Oh.
Good afternoon, Governor. Thank you for having me here again today. I want to provide a quick update to the people of Guam and the CNMI concerning our efforts with the crew of the Theodore Roosevelt and our greater military civilian community. But before I get to that update, I got to give a special thanks and shout out to the hundreds of service members and civilians who have been dedicated to this task with TR since March 25th. Additionally, a special personal shout out from me to the heroes in the hotels, the civilian staff who are out of the spotlight, behind the scenes, making it happen every day to help out our shipmates. Thank you. So the process for getting TR sailors off the ship, tested, and placed into isolation on Naval Base Guam and in quarantine locations is continuing. Nearly 2,000 TR sailors have been moved from the ship and are currently in controlled locations on Naval Base Guam and in Tumon. This number will continue to grow to continue expanding social distancing efforts for the crew and a deep cleaning of the ship. The Navy today announced that 61% of USS Theodore Roosevelt crew have been tested for COVID-19 with 173 positive cases. To date, there have been 0 hospitalizations. I want to reemphasize that even when our sailors receive negative COVID-19 tests, our team continues to conduct daily health checks to make sure that we are doing everything in our power to protect our military and civilian team, to not contribute to the fight to the spread of COVID-19, and to preserve the warfighting readiness of our forces. Finally, thanks again to our governor for her leadership and to our staff for leaning in as we all work to win this fight in this region. Thank you.
Thank you, Admiral, for that update. I also would like to call on Linda DeNorsi to give you again the current status of our COVID cases.
Thank you, Governor. Yesterday, we conducted 16 tests. Altogether, of those 16 tests, 12 were negative, and 3 were follow-ups, and 1 was positive. In addition to that, other than the 16, we added 5 more tests for the CNMI, so that gives a total of 21. The testing for March 12, 2020 to April 6, 2020 was a grand total of 608 tests. Of that 608, 497 are negative and 111 are positive. Of the 111, 102 are local and 9 are from the tests that were done at the U.S. Naval Base, and that test goes through the DoD reference lab in San Diego. In addition, we have 2 clinically diagnosed local cases, thus a grand total of 113 COVID cases as of today. The demographic breakdown of those 113 COVID cases are as follows. 55 are from the northern region of the island, 38 are from the central region, 17 are from the south, 2 are homeless, and 1 is pending determination, thus 113 individuals. The age breakdown of our COVID positive cases are as follows. 0 to 9 years of age, we have 1, 10 to 19 years of age, 5, 20 to 29 years of age, 11, 30 to 39 years of age, 12, 40 to 49 years of age, 20, 50 to 59 years of age, 19, 60 to 69 years of age, 31, 70 to 79 years of age, 9, 80 to 89 years of age, 4, and 90 and above, 1. In regards to the gender, most of them are female, 57, and males, 56. The medical status of all these COVID patients are as follows. 61 are stable, 21 are hospitalized, and of this number, 11 are inpatient at GMH, 2 are in the ICU, and at the SNU, 8. 27 have recovered, that's 2 more as of today, and there are 4 deaths. And just to give you the location of our patients, 36 are in home isolation, 25 are in the isolation of the Government of Guam facility, and again, 8 are at the SNU, 11 are inpatient at GMH, 2 are in the ICU, 27 have recovered, and 4 have died, as I mentioned earlier. In regards to the travel history, 1 is from Japan, 11 from the Philippines, 1 from Singapore, 2 from Dubai, 5 from the US mainland, including Hawaii, and 93 have no travel history at all. So when we look at the cases without any travel history, we have 25 that are household contacts, 11 are community contacts, 13 are healthcare contacts, and of that 13, 5 as a patient and 8 as a healthcare worker. And 44 have no reported contact cases at all. Currently, we have the quarantine sites of the government of Guam, and altogether we have about 132 individuals at our government of Guam quarantine sites. In regards to those travelers that completed the 14-day quarantine, as of today, we have a grand total of 229 individuals that completed the quarantine site. And again, 25 are in our isolation facility. In regards to the 27 that have recovered, I have the demographic breakdown as follows. There are none between the ages of 0 to 19. For the age group of 20 to 29, we have 3, 30 to 39 years of age, 4, 40 to 49 years of age, 5, 50 to 59 years of age, 6, 60 to 69 years of age, 6, 70 to 79 years of age, 1, 80 to 89 years of age, 1, and 90 and above, 1. The sex of those that have fully recovered, 15 are female and 12 are male. In regards to the regional location of these individuals, 5 are from the northern, 13 are from central, 9 are from the southern. And the travel history, we have 7 that traveled 14 days before the onset, 15 have no recent travel histories, and 5 are undetermined. Thank you.
Thank you, Linda. No, wait. I'd like to bring Lillian Posadas, our hospital administrator, just to give you a status update of those that are hospitalized and maybe discharged and their stability. Thank you.
Thank you, Governor. Yes, as of today, this morning, we have a total of 16 individuals who are COVID positive. 2 of those individuals are in our ICU on ventilator. And we also have 5 other individuals who are on the dock as persons under investigation. So we're monitoring them. We're waiting for the results from public health. Hopefully we get those this afternoon. Cumulatively, of all the individuals that we have treated, 13 of those individuals we have released to the facility that the government is making available for individuals who are COVID positive. So they continue, their recovery is continuing on being monitored in a facility. So that's a collection of 13 individuals who have recovered from this condition and continue to recover. Hopefully that they will then be released home. So that's the status right now of the patients that we admit into the hospital and we treat. Thank you.
Thank you, Lillian. Now for questions.
Kevin Kerrigan, Pacific News Center.
Good afternoon, Governor. Can you hear me? Hello? Can you hear me, Governor? Can you hear me, Governor?
Yes, Kevin, I can hear you now.
Okay, I'm sorry. I noticed in your Facebook posting this morning, you detailed a variety of federal programs that'll soon be available, as well as listing some of the local assistance programs that are already available. Speaker's office this morning says the date and time of the emergency session will be announced sometime today. You've asked lawmakers to consider bills that grant you additional enforcement powers, but we know that a number of senators are pushing to enact additional local relief efforts. Would you still encourage them to hold off on that until the federal programs kick in?
You know, some of the bills that they are is actually appropriating money from the general fund to those programs to provide for I guess, a bridge. Um, I think one of them is like $1 million to sort of help for the unemployment period. And we are looking at doing something like that. I'm working with our Department of Revenue and Tax. If they feel that they want to give me some help and some authority, certainly we are welcoming that. But in my inventory of what the federal programs are, there there is funds available without having to use our general funds money. And as I had said earlier, my concern there is if we don't have to use our local funds and federal grants and federal monies are coming in, that would be, I think, the route that I would like to go more so I can save the monies in our general fund so I can provide means to continue on our public services. And that's basically all that I am asking for them to do. Just to reiterate, our tax rebate program, Daphne's working very closely with the IRS, and although she's very close to implementing it, there has to be approval for their implementation. And she's meeting with them tomorrow to approve the implementation. Some of the concerns that may have delayed it have been addressed. And so we are moving forward as fast as we can, Kevin, to first, of course, provide the tax rebate for our community, which would be a great shot in the arms of our individual taxpayers, our couple taxpayers, and also into the community. Um, and the other one, of course, is the pandemic unemployment benefits that would give our people a weekly means of financial assistance for 39 weeks. Right on that program, we are just trying to iron out the details of what that amount is and finalizing and making sure our eligibilities are valid. So um, I haven't seen all of the bills that they're trying to do. I will look at them and I will discuss with them accordingly what the course might be much more, I guess, um, in the area of trying to, again, to save our general fund monies because a lot of these expenses are not expenses that are fronted with the money. We have to get reimbursements. So in order for me to provide the PPEs, the test kits, and all that, we need to use our local monies, and then we will get reimbursed.
Thank you, Governor. As a follow-up on a different subject, at the radio station this morning, we got a number of calls from people who said that they had been stopped on the roads by Guam police, and Sergeant Tupau issued a statement saying that they've implemented an omnipresence at various locations. I'm wondering if that's something that you ordered or approved of, and could it be a substitute for the checkpoints you wanted to implement
Yes.
today?
It is, we're trying to work within our legal authority. And so we are using our legal authority to, again, provide guidance and provide education to these drivers, Kevin. And so my directive to the chief is that if we can use those opportunities that we have legal authority, and but basically to just ask people to stay home, educate them again, and the importance of staying home. We don't have any authority to do any citations right now because there's nothing in the law that that reflects that or that allows that. So we're doing it more for education purposes and reminding people that to follow the directives. And that directive, of course, is to stay home and travel only for essential purposes and essential business. going to the pharmacy, going to the grocery store, going to your medical clinic, making sure your homes are safe and so forth. So that's basically, yes, it is an approval that I had asked the chief to start doing.
Thank you, Kevin. Guam Daily Post, John O'Connor.
Thank you, Governor.
Thank you, John.
Can you hear me, Governor?
Welcome. Yes, I can hear you.
Yesterday,
I can't breathe real well with this mask, but I'm trying. Sorry.
yesterday we heard from Linda that they're investigating a cluster at Iglesia Ni Cristo. We're wondering, are there additional clusters that public health is investigating, and what status, what update can you give us on that investigation?
I think
any?
there were some, and some were cleared already, but I'll have her give you the information.
Yes, on the Iglesia de Cristo, there was a link to other CNMI cases that were found in that area. Right now, I've already given the directive to my staff to get the numbers, because that was asked earlier in the radio station. So we have to gather that information, and we're going to get that out. And yes, there are other areas that we've identified, like other senior centers, that we're going to also provide all the information out in the community. Pretty much the ones that we're going to issue out are the ones that already have not fulfilled the 14-day quarantine. The Hawaii, the half-a-day, as you know, the bingo has already cleared because the 14 days of quarantine is already over. But there are still about 4 or 5 of those areas of social gatherings that we're also linking other COVID positive cases to. And again, we're going to provide that information to the public. And I'm meeting after this with my surveillance team at the Department of Public Health, and we're gathering all that information to make it known. And we'll get that information out from our department through the JIC, the Joint Information Center.
Thank you, Linda. Before I ask my second question, is Admiral Minoni still there? I'd like to get a clarification.
Yes, he is. He is.
Okay.
Go ahead.
Admiral, there are reports of Secretary Motley's statements regarding the Captain Theodore Roosevelt. We just want to clarify, was the Secretary on Guam when he made his remarks?
So the secretary did take a visit to Guam. I'm aware of the comments that are circulating in the media. I haven't read them, I have not heard them, but he did take a tour of all the facilities that have been brought to bear and all the folks that are working on behalf of Tiara Shore, both military and civilian, to understand the massive level of effort that this island has put forth to help those sailors get healthy. Anything else?
Yes. Can you say when he was here?
He was here yesterday.
Thank you for the clarification, sir.
Thanks.
Thank you, John. KUAM, Nestor Laconzo.
Yes, good afternoon, Governor. I just want, it's still not clear to me if there is going to be any local assistance available for those, what I understand are many families who are running out of money to even buy groceries. Could you kind of elaborate on that?
Yes. The local assistance I have said that is immediate right now is your public assistance, general welfare, and also your SNAP program, the food stamps program, which has been again elevated and has been given more money to provide for more people to take its benefit. Accordingly, in the public assistance, I have been working with Tess Archangel to make sure that The application process, the eligibility process is expeditedly done so we can provide the assistance to these individuals. I have also asked her, which she's doing, to raise the income poverty level so that more individuals could qualify. So, Nestor, when I was looking to see what is the fastest way to get help to these individuals before we get the unemployment program and the tax rebate, I looked at what do I have now that we can take advantage of, and those were the two programs right away, which is the SNAP program, the food stamp program. It's known as the food stamp program, but they've changed it now to the SNAP with the cards, and then the public assistance. And my understanding with the test is there's over 300 new eligible people that have qualified for the SNAP program. So we have 300 more people in our community that is taking advantage of that. The same with the public assistance. The other program from a healthcare perspective is the medically indigent program, which now we can also use Medicaid monies for the indigent people that need health insurance and care.
Thank you, Governor. Second question is, when the senators finally do go into emergency session, and just to follow up with what Kevin was asking, any appropriation measures that they come up with are, in your mind, pretty much dead in the water? You will veto them?
I did not say that. I didn't say I was going to veto it. I just said that I do appreciate the help that they're doing to try and, everybody's trying to help. And I think that's a plus and a uniqueness in our community here. You've seen this whenever there's a disaster, really, the community rallies behind everybody and they try to help. And certainly, whatever policies and whatever legislation that the senators feel that would allow me greater authority and much quicker resources, I will certainly look at that. Certainly, I will look at that. I never once said that I didn't appreciate it. I never once said that it's dead in the water. I never once said that I would veto anything. I'm just saying that I'd like to look at how we can best use federal monies instead of for general fund monies, because I'd like to use that more to be able to pay for the expenses so we can continue on providing health, education, and safety to our island. That's basically where I was coming from in that issue and in that concern. But I do also want to emphasize, Nestor, since the legislature, I do need, and the senators know this, more authority for the curfew situation and the checkpoint situation, and to be able to enforce my executive order directives and mandates.
Thank you, Nestor. I-94, Chris Barnett.
Off a day, Governor.
Have a day, Chris.
I just want to say you look absolutely lovely with your mask.
Thank you, Chris.
I just wanted to ask, I had a question for you and Admiral Manoni. Obviously a lot of people on Guam and around the world are talking about the comments made here on our island by Acting Secretary of the Navy, Thomas Modly. He was talking about Captain Brett Crozier. He said he was either too naive or too stupid to be in command of the Theodore Roosevelt. He also accused Crozier of committing a betrayal and creating a big controversy in Washington. I know earlier, I believe it was last week, Admiral Manoni had said that Captain Crozier had a moral obligation to inform his superiors about the conditions on the TR. So I guess my question for both of you guys is, do you believe that Captain Brett Crozier is a COVID hero?
I don't know Captain Crozier at all. I think Captain Crozier was doing whatever he thought he needed to do. I really can't comment about, the military chain of command, the importance of following the protocol. I know that in any kind of military discipline and guidance. The military are very, very strict in making sure people follow protocol, people follow chain of command, because they need to do that in order to provide order and force out there in terms of our national security, and making sure that the vessel is nationally ready for national security and ready for whatever threats are up out there. So I don't know, Captain Crozier. I do know that everyone is just as concerned about this COVID crisis situation, and we all want to protect our people. We all want to protect our forces. We all want to protect our men and women, our children, and our manamko. And so, if that's the definition of COVID hero, then that's the definition of COVID hero. I think all of us are COVID heroes. All the frontliners are COVID heroes. Everyone who's working very hard out there um, to be able to, safeguard our community and to be able to fight this battle. I don't know if that more than else to add on.
So I'm not going to comment again specifically on the Secretary's comments. Please feel free to contact the Secretary of the Navy's Public Affairs team. I believe what I said last week was, as commanders, we have a moral obligation to our mission. We have a moral obligation to take care of the people under our charge. I didn't say it exactly like that, but you get the point. I will tell you, and I want to foot stomp this, that there has been a massive level of effort on this island by both military and civilians, government of Guam, and local folks to get ready for and then try and help TR sailors as best we possibly can. I'm seeing every day people innovate, people work hard to make sure they break down barriers, people find out where the constraints are in any system that prevent any help getting to those sailors. What I'd like to also emphasize is that we're on the front lines and a leading edge of learning about how these viruses move through ships. And we're going to take what we learned here from a logistics, from a medical, from a protection standpoint, and apply that moving forward to help build capability and capacity here within the region should COVID-19 really become a problem. Thanks.
Okay, for my second question, I'd like to ask Lillian Posadas of Guam Memorial Hospital, please, Governor.
Oh, okay, sure, Lillian.
Okay.
Thank you, Governor. Yes, Chris.
Off a day, Lillian.
Half a day.
I just wanted to ask because yesterday we'd interviewed Dr. Akimoto about moving the child maternity ward to GRMC, and he had said that one of the main reasons that's not being done is because the Guam Memorial Hospital can't afford to lose the nurses, and that these nurses in the child maternity health ward are cross-trained to also be COVID-19 responders. I guess I have a two-part question. Is that accurate? And then secondly, are we dealing with a shortage of nurses relative to nurses, calling in sick, nurses not showing up because of the risk associated with COVID-19?
Okay, in response to the first part, that is so inaccurate, so untrue. The decision to not move the MCH is not because we're trying to save our nurses and whatever it is that you came up with. The priority, and as I've mentioned it before, is that, based on data and based on the science and based on what we're seeing at the national level, is that the high-risk population are the adults. And so therefore, that is really our goal, to decompress the hospital. And we're moving the elderly patients out of the SNU to another location. We're then also moving the telemetry. Those are the adult acute care area on third floor. Sorry, I have to take this off. I'm kind of getting all fogged up here. But we're moving the next area that we're moving is the telemetry unit, and that's the third floor adult care unit. We're moving those patients who are non-COVID we're getting them over to GRMC, and GRMC has been very helpful to accept non-COVID patients. So that's the next area that we're then increasing our bed capacity for COVID patients. MCH, as we have seen, and you know, we've seen at the national level, is really not the high risk area. And so we're still, that will be at the bottom of our priority of our strategies to then move to decompress the hospital so we can continue to increase our bed capacity for these COVID patients. So does that answer your first question?
Yes, Lillian, but what would you say to expected mothers who are being told that they have to deliver in a COVID hospital, though?
Well, it's not that they have to deliver in a COVID hospital. GMH is the hospital. And so, and it's been happening since, you know, GRMC closed their doors to MCH clients. We are the hospital. We are it for expectant mothers to deliver their babies. So, and we exercise and we really put into effect all the measures that we possibly can to protect them, to make sure that they don't have that exposure, and to really just limit and protect them from the exposure. So they're protected. They're away from the areas where the COVID positive patients are. We manage their care. So we ensure, and you know, again, we protect them as much as possible. We keep them isolated from the NCH clients. And as far as the second part to your question, nursing shortage, yes, Guam has always had that perennial nursing shortage, but we are working as a team with GRMC and also with the school nurses and public health nurses to try and assign them, deploy them to where we really need to utilize their skills. DOE nurses have been used to help out at the airport and also at the Port Authority. And so we're trying to shift again those resources around to then put them over at GRMC so that they can then staff the units where we can then decompress GMH of the non-COVID patient. So, you know, we're dealing as best we can with all the limited resources that we have.
Thank you, Chris. Pacific Island Times, Marvick.
Hi. Hello.
Hi, Marvick.
Hello, Governor. I want to ask about palliative care, which is right up your alley, being a nurse. We know that the elder patients and those with comorbidities have to stay at the hospital instead of being placed in home quarantine. And we know that they are facing difficult or unlikely recovery, and not to mention loneliness in isolation. What kind of comfort care does GMH provide to these patients, and how is this being managed given that families are not supposed to stand close to them?
Okay, I'll have Lillian answer that.
Thank you, Governor. You know, because again, we want to make sure we protect and minimize the transmission of this infection, of this disease. We do provide telecommunications through their devices that families sometimes provide, like a phone or an iPad. And so virtual connection with their family that they can then have a conversation and still feel connected to their family. And so that's how we accommodate these individuals in the units to still have that contact and connection and conversation with their families.
Okay, so regarding the 4 patients who died, did the families get a chance to say goodbye to them or talk to them within the 6 feet distance?
Not in person at all, but through virtual connection with their cell phones or with the iPads that we provide. So they, you know, again, the key here is to minimize the transmission, prevent further transmission of the infection. So families, unfortunately, because of the situation, we don't want them to be there in person, in physical, you know, person right at the bedside. But we do allow them to see each other and say their goodbyes through virtual communication.
Okay, one last question. Are there exemptions for families with patients who may be in their end of life situation? Are they exempted from the hospital's restrictions on visitors' access to the hospital?
Again, because we're trying to minimize transmission, the spread, really is for the protection of and the health and safety of everybody concerned. Um, we have not allowed visitors into the hospital unless they are the parent of a pediatric patient. We allow the parent to be there. Um, for expectant mothers, we allow their husbands to be there at the bedside, coaching their spouse who are in the labor and delivery process. But anybody else, we do not allow visitors at all because we are trying to really minimize the transmission, the spread of this infection. Does that answer your question? Hello?
I'm sorry, you didn't part of it. Next question. Oyal from the Point.
Half a day. Madam Governor, good afternoon. I think my first question is actually for Ms. Lillian, if I may.
Okay, Lillian, you're popular today.
Very popular.
I know, and I did fix my hair good.
It looks
All righty.
beautiful. Ma'am, SNU nurses have been staying in hotels while GMH nurses are not. Why is that? And on top of that, are they going to be getting? Are any of these nurses going to be getting the PPEs from the national stockpile that I believe we're expecting anytime now?
We've been providing PPEs from day one. When we first started hearing about a PUI coming into the hospital, we provided the PPEs. We made sure that the staff go through the fit testing for the N95 that they have to wear, whenever they are in direct contact, especially if they're doing any aerosolized procedure with the patient. The N95 is what we provide, yes. And yes, we are burning up these supplies, but we still have some. And we're expecting more to come in from the stockpile. And so it's an ongoing training of all staff to make sure that they are provided the PPEs at the same time that they know how to put on the PPE properly, and especially to take off these PPE properly. Because there is a process, there is a method to make sure that they don't just, take off the gear and that virus or whatever bacteria gets spread out. So there is a proper process and procedure for that, and we make sure that they go through that training. We are running low on supplies, but we are getting some also, and so we still have enough, and we are using it.
Ma'am, and I'm sorry, the beginning part of that question was the SNU nurses have been staying at hotels, but the GMH nurses we're hearing are not. They return home to their families. Okay. Why is there a difference in
when we first started it, Oya, when we first started it with the SNF in planning, we wanted to make sure that we had that additional layer of protection for the staff to decontaminate before they go home. We made it available. Some choose not to take that opportunity. We also asked the nurses at the hospital, would they be willing to? Majority of them said no, they'd rather go home. So that's what's happening. We are also making it available for the staff who are in the acute side of the hospital. We are getting those accommodations for them, and still it's optional. So some people would just prefer to go home to their families. So we're respecting that wish, but we are going to have that available for not just the nurses, but even like respiratory therapists who provide breathing treatments for these COVID positive patients. So it is going to be available, extended, and increased number of bed rooms for them.
Ma'am, considering the number of nurses and other healthcare professionals who have tested COVID positive, though, is there a point where you are going to make that mandatory in terms of having them go to a hotel and not go home so that, where they're not infecting their loved ones?
We can offer it, but I'm not sure that we really want to make it mandatory because, again, some of them would like to be home with their families in the comfort of their home. So, I prefer that it's optional, that it's their choice. They're free to make that choice.
Yes, ma'am.
And again, with the instructions of making sure that they, follow in terms of self-isolation. If they are COVID positive, self-isolation. If they are PUIs because they've been exposed to a patient who is COVID positive, they will then be self-quarantined, but then they can be quarantined in a hotel.
Yes, ma'am. Thank you.
Thank you.
As for the
Did you need
my
me
second
to?
question, my second question was for the governor.
Yes, oh yeah. I thought that was like number 4 question.
Well, you gave.
You're like
Chris-
Nestor.
I've known Nestor a long time. He's a very good reporter. So I learned from him, from the best.
Yeah, right. Okay, good.
Ma'am, you know that you did extend differential pay to many of the Guam employees, many of whom are on the front lines, and I'm sure fully deserve that pay. The question I just had was, are you also allowing your cabinet members, including directors and Adelup staffers, to qualify for that differential pay?
So our, this is our COVID special pay that we had actually vetted through and decided that there are 3 layers. And, one layer is the direct contact. The other layer is incidental contact. And then the last layer is those that are there to provide administrative support for staff that are dealing with the COVID virus. So it's all related to risk. Oh yeah. So we try to make it as equitable as possible that we can, going from the one with the most risk to the maybe moderate and then to the less. Our cabinet members are not getting any of those. I'm not getting it. Lieutenant Governor's not getting it. Our cabinet members are not getting it. If there are administrative people that are working as a result of, the COVID, they would probably get the 10%. And so that's how we tried to lay it out as best as we could, given the risk levels of those various workers.
Thank you, Ann. Maureen Maratita, Mariana's Business Journal.
Good afternoon, Governor.
Hi, Maureen.
So I wanted to ask about the people that you said were getting public assistance, about 300 of them. So is that over a day, or what time period was that? And if
I
that
think
number
it's from Tess, I think said from April 1st to present, I think.
Okay, so the second part of that question was, if that number doubles or triples, is there still enough funding that you have available right now?
Yes.
Okay, good to hear. And I have a question for the Admiral, if I may. My second question.
Sure, go ahead.
Good
Go ahead.
afternoon, sir.
Good afternoon.
So you said nearly 2,000 sailors have been moved off the ship, and you have 173 positive cases. Is that anywhere on the trajectory? Are you pleased with that? And also, where are we in the cleaning of the ship and readying it to go to sea?
Okay. First, I'm a naval aviator, and we have a maxim never to do public math. So I'm not going to try and do that math that you just gave me. But I will tell you that I'm extremely pleased with the logistics effort. And remember, there are some significant challenges here in the Marianas Island that I don't think maybe are known as widely as they should be. One of them is it's a 12-hour flight from Washington, D.C., I believe, to Hawaii. Guam is another 7.5 hours from Hawaii. So when a ship like this pulls in, it's all hands on deck, both on the military side and the civilian side, to make sure we can do everything we possibly can to get ready for that ship. And then if they have an issue, we have to work doubly hard to make sure that we can work through that issue as a team. With respect to the trajectory, that is a doctor question, a medical question that I really can't answer at this time. I am, again, pleased with the efforts of the team on the ship as well as off the ship to take care of those sailors. And then finally, with respect to cleaning of the ship, that's ongoing. I'm assured that they have the supplies that they need on the ship to do that cleaning, and that both on island and off island in the greater military community, we're looking at potentially some innovative ways to do this better should we see other ships have this issue. I hope that answers your question.
Yes, thank you very much, Admiral.
Thank you, Maureen. Pacific Daily News, Stephen Tiago.
Yes, hi, Governor.
Hi, Steve.
So my first question is, if Guam receives thousands more virus testing kits, which was mentioned on Monday, will the current testing protocol be changed to allow more people to be tested by the government?
Yes, we would of course continue on with our same protocol, but we would like to also add in that the healthcare workers, the frontliners, the EMTs, the police, those individuals that we know on a daily basis have a risk of contacting the virus because of the work and responsibilities that they have to do. So we would allow the healthcare workers. We would also probably look at those contact people that have had direct contacts with people that have out in the community been found to be positive as a result of the works of the public health in terms of investigation and surveillance and contact tracing. So we would want to look at what is the status of those that have direct contacts with a positive COVID patient.
Okay, and my second question is just going back to the omnipresent police force. Since the AG says you need additional legal authority for checkpoints, who exactly is GPD allowed to pull over in order to educate and advise to stay home?
So I understand that they, we're doing, I think speed, what is this called? Speed bumps or speed monitoring. Sorry, speed checks. And so if someone is, speeding and so forth, they pull them over. That's within our legal authority, and they can give citation for that. And meanwhile, also, they would ask, where are you going? And again, educate them.
Gotcha. So it's speeders then, right? That's who they're pulling over specifically at this point, speeders. Gotcha.
That's my understanding.
Okay. Thank you, Governor.
That's it, Steve?
Last but not least, Patty Arroyo, K57.
Good afternoon, Governor. Thank you for taking the time. I was falling asleep there. So many people had so many questions. I do have.
You work really early in the morning too, so.
Thank you for recognizing that. I have to ask you about the testing. There were 13 tests that were done yesterday with 1 positive, but that's after there were 17 positive tests that were announced over the weekend.
Right.
And are we having an issue with test kits? Are there enough that we can continue to test?
No, we do have enough test kits. It's the demand or the volume that have come in. Some days we have like a lot from either GMH, medical, AMC, SDA, other places. And then some days we don't have that many. I would like to have it where they won't have any, but that's just how the trend is looking. There's some days where there's a lot, and then of course we also are starting to see more samples being flown in from CNMI and also from the other regional islands. I think we had a few from Palau. I think we had from FSM. I think we had from RMI, but they were all negative. So, that's also another factor because of the fact that we are the regional laboratory here for public health, not just with this COVID, but I think for other infectious diseases also.
And I have one more question, and then if you wouldn't mind indulging me, one question to the Admiral. Governor,
Sure.
where are we? Where are we in a plan for the homeless?
We were just talking about that this morning, Patty, because we're getting guidance from CDC and also the National Governors Association. And my preference is this, to just put them all in one place. But the guidance is not to do that. We cannot involuntary put them in those situations. It's a voluntary. So instead of them being brought in for the resources, the advice is bring the resources out to them. So wherever they are, we're trying to set up tents for them, individual tents maybe, be able to have the porta potty, shower, that kind of stuff, and monitor them that way. So we've been working very closely with the HUD. We've been working very closely with also the coalition and also Homeland Security because, a lot of them, Patty, don't want to be housed. And so we need to also, in this challenging times, be very mindful of people's civil rights and civil liberties. We can't force them to do that. So we're working to identify, which I think some of that information is already available. Where exactly are they, much more at? Are they, I know there's a lot in Agana, so we're trying to see where we can place these tents so that they can come. But the advice is not to do herding of all these homeless people into one big situation, big space.
Thank you, Governor. And my next question for Admiral Manoni.
Hi, Patty.
Hi, good afternoon, sir. Sir, do you have a policy in place that limits mobility of dependents travel off base?
Patty, there's no policy that limits dependents on and off base. What we're asking people to do is comply with the governor's orders concerning dependent travel in and around Guam. The policy of staying at home, going out for essential services, specifically grocery stores, gas stations, pharmacies. Then obviously, if there's an issue, getting to some sort of medical care.
Just a final question to you.
Sure.
I know that this situation happening nationally with the spotlight on Guam with the embattled Captain Crozier is far out of your reach of comment. However, with the Theodore Roosevelt in our port and Guam in central location as a backdrop to the controversy, what is the mood or morale of other troops that are on the sidelines watching how this has been handled and the potential that there is some impact on troops, so the sailors who service this area, and what has happened nationally with the Theodore Roosevelt?
So, Patty, I can't talk to, you understand, I can't speak to the national military mood or anything outside of my certainly realm of influence or regional responsibilities, just because it's not possible to do that. I'll tell you, from the troops that I interact with on a daily basis, and that's down on the naval base, that's up at Anderson, that's at the Naval Hospital, that's at the hotels, the crews that are working that, including the help that's being flown in from the greater DoD enterprise. Morale is great. You know, it's akin to a fireman and a fire. The fireman wants to help. The police officer, first responder wants to help. So everybody is pitched into this fight to defeat COVID on this island. And we're going to get through it. And it's not just about TR. It's about this island. It's about this greater region winning this battle together. So I haven't seen anybody slowing down or hanging their heads. Everybody's working their butts off, not only to get the TR crew healthy and back to sea, but to make sure that we're prepared should the crisis increase out here in Guam. I hope that answers your question.
Thank you, Patty. And now closing remarks from the governor.
As you can see from all of the people here that have answered questions, there is truly the importance is to make sure that we let the people know exactly where we're at, let the people know exactly what our capabilities are, make the people know exactly what plans are in place to help not just the health of our island, but also the economy of our island. And I just wanted to add that in this whole thing of the crisis of the COVID, there are two very, very compelling interests here. One is the health of our people, saving lives, making sure that this COVID virus does not infect any more people. And the other one is, as a result of the COVID virus, we now are looking at the health of our economy. And the health of our economy is a great concern for me, just as the health of our people. Because without a great economic environment, the quality of life of our people won't be there. So I just want the people to know that I am very concerned about that. And I am working to see how we can get the money out there as fast as we can for the economic stimulus of our people. Right now, we don't have much of an economic business out there because we have closed those places, rightfully so, to protect the health of our people. Once we feel that that is going to be recovering, we will, of course, gradually lift restrictions so that we can continue now to focus on the economic stimulus and the health of our economy. But I want you to know that I am simultaneously just as concerned of both aspects of this, both aspects of our community. So that's why I'm pushing really hard to bring out those economic benefits for our people. I'm also pushing very hard for our business community to take advantage of the business loans that are being put out there by the federal government in conjunction with financial institutions so that they can get the cash that they need to continue operating their business or to start operating their business. The federal business loans are very generous. They are even allowing forgiveness on the loan if you continue to pay your employees, because the goal here is to try and keep employees employed as much as possible so that when we're ready to also lift restrictions and start activating our businesses, that they're there and they're ready to provide the business services. So just for the information of our public and our people, this whole crisis has really changed the way we are going to do business now. It's changing the way we're relating to each other. It's changing the ways of our culture. It's something that is so different. It's something that is a lot of uncertainties that we don't know. It's something that's impacting our lives every day and very quickly. And again, what I am pleading is that let's continue working together to stop this virus. And as you can see from some of our progresses, we are getting recoveries. There's 27 recoveries now out of 113 confirmed cases. That's a good sign. But I'm saying let's continue on with our guards. You know, if you're progressing and winning the battle, you don't pull back so that the enemy again continues to impact you and to threaten your lives and to try to win the battle. So the more we win the battle, I think the harder we should work together so that we can completely eradicate this virus. How do we do that? Stay home. Decrease your contacts with people. Do social distancing. Wear a mask. I know it's a burden, but we need to do it all for the good of our people and for the welfare of our people so that we can again win this battle. Thank you, and si Jules Masi.